No one should be needlessly restrained at a nursing home. My name is Justin Varughese, and I'm one of the nursing home abuse attorneys here at Parker Waichman. I just wanted to take a couple minutes to talk with you about some things you should know if you believe a loved one is being restrained at a nursing home in some way, either physically or in some other way. One thing that most people don't realize is that there are very limited circumstances in which a nursing home is permitted to restrain one of its residents, and most often it comes in the form of a doctor's order or doctor's prescription. A medical professional, a doctor, would need to assess a resident and determine, for whatever reason that they feel appropriate, that that resident should be either physically or chemically restrained in some way. At no point should a nurse or the nursing staff be making a decision to physically restrain a resident. And 9 times out of 10, when it's inappropriately done, it's done to help make the nursing home staff's job a little bit easier. Now, what does a physical restraint look like? These are the more obvious ones. Sometimes you'll see a resident actually tied by their wrists to their bed as a way to prevent them from moving their arms or from getting up. Sometimes you'll see them belted down onto their bed or onto their wheelchair, or you'll see side rails that are up on the sides of their bed that are so high that they're not able to leave their bed. They're constricted, almost like a prison. Those types of restraints, like I said, are sometimes appropriate, but usually only by a doctor's order. Now, those are sort of the more obvious types of restraints. Then there are these less obvious restraints that come in the form of a chemical restraint. What does that look like? Well, oftentimes, at the prescription of a doctor, once again, residents will be prescribed some type of a sedative, maybe something that will help them sleep more, or that'll help them become more lethargic. There's few circumstances where that also is appropriate. If you see these types of things in your loved one, you see a physical restraint, talk to the doctor, talk to the nurses. And the other thing that you can do is pick up the phone and give me a call. I want to answer your questions. I handle cases like this every single day. So would you pick up the phone, give me a call, and we'll talk about it, and I'll see if there's anything I can do for you. Thank you for taking the time.